and welcome to the Cardon Resource Hub. I'm Laurie Lasbury, Director of Community Engagement, and today we have with us Lisa Dillman, owner and attorney at Dillman and Owen. Today, she's going to talk a little bit about Medicare and Medicaid, which so many people get confused. Lisa, can you help us out on those topics?
Sure. The words sound very, very similar, but they couldn't be more different. Let's talk about Medicare first. Medicare is what most people have and use as their primary insurance coverage. So Medicare is available for anyone over 65, blind or disabled. So that, and they use Medicare as their primary health insurance coverage. So let's talk just briefly about the different parts of Medicare. Sometimes you hear people talking about Medicare Part A or Medicare Part D. Let's go through those and just get kind of a primer on all the different kinds of Medicare coverage that's out there. Part A of Medicare is hospital coverage. So if you have Medicare as your primary insurer, then when you present to the hospital, it's Medicare Part A that's paying for that stay, and it's also paying for any treatment that you receive in the hospital. Medicare Part B, think of that more like doctor's visits and in-office visits and maybe some therapies and treatments and things like that. Medicare Part B, well, I guess I should back up. Both Part A and Part B have a premium, and you pay that premium as a deduction from your Social Security check. So that's how you just automatically get Medicare. You are paying a premium, but it's coming out of your Social Security check. Medicare Part D is drug coverage. So you might have been adding up there thinking, oh, she doesn't know her alphabet. You've got A, you've got B, you've got D. What about C? Well, the part between B and D is a gap, okay? That's where you buy your Medicare supplemental policy. So it's a Medigap policy that you're purchasing, right? So you will maybe meet with somebody and during open enrollment and buy a policy from Anthem or from United Healthcare. That fits in between Medicare B and Medicare D. And it's that policy that will pay for anything that A, B, or D doesn't cover. So that's kind of how Medicare coverages break down. A big question that I get a lot is, hey, I've suffered a stroke and I had Medicare cover my hospital stay, but now I need rehab. Does Medicare pay for my rehab? Well, Medicare Part A pays for the first 21 days of your rehabilitation stay. Whether you get any more coverage for rehab is determined by your Medigap policy. So during open enrollment, you'll really want to try to understand, does that Medigap policy provide any rehabilitation coverage? And most policies cover maybe anywhere from day 22 to 90. Some cover up to 100, some cover 0. So that's something that you're really going to want to know and understand when you are doing your open enrollment and buying that Medigap policy. One more important thing that you need to know about getting that rehabilitation coverage through Medicare is that when you present to the hospital with your medical event, it's really, really important that you become admitted to the hospital, not just under observation, but admitted, and you need to stay for 3 midnights. If you get discharged from the hospital to rehab after you've been admitted and you've stayed for 3 midnights, that's what activates that first 21 days of Medicare coverage. So if you're finding yourself in a position where they want to discharge you and it's only been a couple of days, that's when you're going to want to advocate for yourself, or maybe your power of attorney or healthcare power of attorney advocates for you to get that one more night stay. Because it's been my experience that healthcare providers want to help you get the best care possible. And that rehabilitation is really good care. It's designed to get you back to your home and living on your own terms. So we really try to fight for that that Medicare coverage over in rehab. So that's kind of what Medicare covers. Now, what does Medicaid cover? A lot of people think Medicaid is for poor people, low income, no assets. Let me tell you, there's over 33 different Medicaid programs just in Indiana. So Medicaid has a program for low-income mothers with children. Medicaid has a program for those who have cancer. Medicaid has a program for people who can't afford any type of health insurance. But the part that, or the Medicaid program that we spend a lot of our time in is the long-term care Medicaid. So essentially, what happens is when you are trying to figure out how am I going to get the care that I need, either in an assisted living, at home, or in a skilled nursing facility, but you can't afford the private pay daily rate, Medicaid can come in and help defray the cost of that care. A lot of people think that long-term care Medicaid is determined by how much money you make or how many assets you have. The long-term care Medicaid is tested by income and tested by assets, but the overarching rule is it doesn't matter how much income you earn or how many assets you have an opportunity to become eligible for Medicaid to pay for long-term care. And why is that rule available? Well, let me back up and try to explain how Medicaid money finds its way to the state of Indiana. The Medicaid is a federal program that funds states with money to help seniors pay for long-term care. They give that money to the states, and then the states decide how those seniors or disabled folks become eligible for that help. There's two important laws on the books that are federal. Number one, it's called the Spousal Impoverishment Law. So if you are in a married couple and one spouse needs long-term care, the Spousal Impoverishment Law permits the healthy spouse to reconfigure assets and preserve all assets back to that healthy spouse. The concept or the philosophy behind that rule is that if the healthy spouse has to spend the couple's life savings paying for that first person who became sick, then that healthy spouse will become impoverished. And that impoverished healthy spouse has a longer life expectancy than the spouse who needs long-term care first. And if that healthy spouse goes broke, then they will need federal assistance for housing, transportation, food, healthcare. So that healthy spouse is going to cost more in the long run. Therefore, the federal government says, let's help pay for that first sick spouse so we can preserve that healthy spouse from becoming impoverished. So when I say Medicaid eligibility doesn't matter how much money you make or how many assets you have, that's kind of why I'm telling you that, because we just have to follow the rules of spousal impoverishment in order to preserve all of those assets back. Now, let's say you're not part of a married couple. Let's say you're a single person. There are laws on the books that permit you to preserve a portion of your assets. And usually that portion is anywhere between 50% of your assets and 80% of your assets. Now, you might ask, well, if you're a single person and you need long-term care, why wouldn't they just make you pay? Well, the whole concept behind the funds that help people get the long-term care that they need is that they want to rehabilitate folks and get them back into the community so they can age at home, they can age independently, and that the resources in skilled nursing facilities, assisted livings can be available for more people. So people who are more acutely ill could take advantage of the services that are offered. But if I'm in a long-term care facility for quite some time, trying to rehabilitate from a stroke, let's say, and I have to private pay, by the time I'm able to be discharged back to my house, I might not have a house left because I might be broke. So the single preservation laws on the books say that it doesn't matter how much money you make or how many assets you have, we can reconfigure those assets to preserve at least half of what you had going in. So a lot of people think that they have to spend down to zero or that they just would never become eligible for Medicaid. But I think they have a misunderstanding of what long-term care Medicaid in the state of Indiana is really intended for. It's intended to get people back into the community. It's intended to keep married couples and families from depleting their entire life savings to pay for a medical event. So those are the two main differences between Medicare and Medicaid. I warned you, they sound alike, but they're very, very different.
That was a great explanation of the two. As an elder law attorney, and I have aging parents at home, as I see them maybe not being able to function quite as well at home, or what would be the number one piece of advice you would have for somebody in my shoes as an elder law attorney?
I'm so glad you asked the question. No hesitation here. I would want to make sure that your folks have legal documents in place that allow you to help them. Do they have financial powers of attorney? Do they have healthcare powers of attorney? Have they been given the opportunity or the voice to basically document their wishes? Because I mean, I hate to say it, I don't even want to think about it in my own family, but it's not a matter of if something will eventually happen, it's a matter of when. And the more that you can just kind of swallow that pill and get your instructions and your wishes documented, it's such a gift to yourself and to your adult children that are helping you.
Lisa, that was such a great piece of advice. I really appreciate it. I appreciate your time and you stepping away for a bit from your practice to be able to be a resource to our community. So thank you very much.
Of
And I
course.
hope to speak to you again soon.
Thanks.